I want to say thank you to the network for having me present, and just knowing that this is really important work across the country, but also across the world too, knowing that we are supporting the transition of another generation through our educational systems, and to kind of solve the problems that are showing up right now. I'd like to start my presentation just taking time to acknowledge that I live, work, and play on the traditional territories of the Blackfoot Confederacy, the Siksika, the Kainai, the Piikani, the Tsuut'ina, the Stoney Nakoda Nations, the Métis Nation of Alberta Region 3, and all who make their homes on Treaty 7 land in Southern Alberta. Part of, I guess, my connection and commitment to reconciliation is making sure that my nursing practice and my teaching is really grounded in decolonizing some of my understandings of where knowledge comes from, who our sources are, and what we consider to be truth. And so as I talk today, a lot of that is based on the reflections that I've had working through personal understandings, but also in research and in the post-secondary space as well. I think it's important for us to reflect on where we get our understanding from and where some of our truths are rooted as well. So a lot of my discussions today, or presenting topics today, will be based on the work that I've done at the University of Calgary over the last 6 years. I recently left the university, and I'm super excited to be talking about the fantastic work that's happened there over the last 6 years. And to be honest, I'd like to just probably acknowledge the work of my colleagues who are continuing to do this work at the university under the campus mental health strategy. And I'll share a little bit about that as I come to the end of today's presentation. So to start off with, I think it's important in this work around equity, diversity, inclusion, and mental health is really figuring out who our students are. One of the largest bodies of research data around post-secondary mental health is through the NCHA, which is the National College Health Association. And that is an association that collects data every 3 years around the mental health or well-being in general of post-secondary students, and it's shared across North America. And I thought it would be helpful to use this data set to talk today, because I think it covers and is able to be generalized across our different campuses. And so this research looks at a number of different topics, including general health, healthcare utilization, academic performance, but also, like we're talking about today, mental health and well-being as well. And so I think it's important when we look at data and research around mental health to talk about how we ask students to identify themselves. I think for me, this is one of the biggest areas that we've found challenging, because we can look at a demographic characteristic form like this and be able to look at things like age and gender and housing and how students describe themselves. But I find that, or we found over the last couple of years, that identity can be one of the biggest areas of confusion for students, because people come to us in many different ways, many different titles. And our language for not only identity, but mental health can be very different across the spectrum. One of the best examples that I see of this is when we complete research demographic. I was talking about the importance of language when it comes to looking at how we seek characteristics or sociodemographic data. And one of the things that we found can be interesting when you look into how people identify is our international versus domestic characteristics, and we ask people to identify in that way. So there are many students who move here as permanent residents in Canada, for example, but really have an international student experience while they're at the University of Calgary, for example. And so when you look at people who identify as international students versus permanent residents or domestic citizens, what we find is that data can kind of skew people's experiences, right? So we look at people who might have moved here and have only been in Canada potentially for 6 months, but they might identify in the system as a Canadian citizen or permanent resident, but they are utilizing all of the resources to support their mental health as an international student would, for example. And so I find that being able to ask people or learn more about how people identify can be very helpful to figure out how best to provide services to students. And so those students are not only utilizing services that we present to international students, but potentially also Indigenous students as well, knowing that people aren't necessarily Indigenous to Canada, but maybe Indigenous to other places in the world. Another thing that I found to be interesting when it comes to gathering data on mental health with an EDI lens is the presence of stigma and how people understand and internalize mental health. I think we do have a system that tends to be very, is not very strengths focused. And so I think a lot of our research is very clinically inclined. So you're asking people to identify if they have any diagnoses, how it's being treated. And so a lot of that stigma kind of filters through how people interpret and utilize our supports. And so something that we've identified, or I've identified in the last couple of years of work, is the ability to acknowledge that stigma exists, but also create strategies and initiatives that help to break down barriers that might be stopping people from accessing supports. And it's important to note that based on the kind of systems that we live and work in, these are not just individual internalized barriers, but also systemic ones as well. If we look at systems that are in place to disenfranchise people to access mental health supports, those are significant factors that need to be taken into account when we're doing research. And so some of the things that I found to be helpful to acknowledge and identify and sort of work through some of these stigmas that show up both individually and systemically are things like peer support. So we have at the University of Calgary, there's a large peer support program that sweeps kind of across different faculties for undergraduate, for graduate students. And I found that people feel more comfortable accessing supports when they can identify with those that are providing the supports. And so having students who are able to talk to other students about how they are feeling and having someone be able to recognize that this struggle is not just to me, but is really universal in the learned experience can be quite helpful. One of the areas that has been identified as a strong area of well-being is spiritual well-being. And it's something that I feel like there isn't a lot of research on in terms of how spiritual well-being improves students' overall well-being. And so I think one of the programs that I always like to highlight when we talk about improving student well-being is our Faith and Spirituality Center, and how the implementation of some of the initiatives through there have been able to support the well-being of our students as a whole. I think it's also important to know that it's not just kind of initiatives or social connections that are important to implement positive well-being on our campuses, but also looking at our policies through a mental health lens. And we know that there are a number of national standards that are now kind of coming up, both in Canada and abroad, to standardize the kind of supports that we provide to students across our campuses. And so I think being able to utilize not only our academic policies, but also looking at our support policies across different areas with a mental health lens. And that includes things like accessibility as well, knowing that things like neurodiversity and accessibility concerns are increasingly being recognized as a significant part of student well-being on campuses. And so being able to put together some of these things, knowing that not every population will be impacted the same, and that every policy has to be specifically looked at for supporting student well-being, depending on the identities that students have. Some of the faculties that we've worked with, I think, have done a really good job of being able to identify particular populations within their scope to talk about how mental health can be kind of facilitated in a better way. And I think part of the work that we do in mental health research, we need to be a bit more reflective about the biases that can show up in how we recruit, who we recruit for, and the kind of people that are doing the research. Some of the stats that we look at when it comes to even the NCHA, the majority of our stats are not representative of our visible minorities on campus. And so I think it's important to look at how we gatekeep access to mental health research, who's conducting it, and how we're able to more effectively disseminate, the findings that we have. Part of, I think, that work is also knowing that we have a sort of a gap between our evidence-based practice and the funding that's necessary to do the work. So I think sometimes that's a bit of a difficult conversation for us to have in terms of the fact that we have all of this great research coming out, but we need the funding to be able to implement some of the strategies that we're identifying. So if we know that more students would benefit from having representative counselors that look like them, that understand their lived experience, we know that we need money and funding to do that, to hire those counselors, to retain those counselors. I think there's a lot of great work being done, in order to create teams that are diverse and essentially the same or replicable of the populations that we serve as well. We know that students are more likely to access counseling if they know that a counselor can understand their experience. They don't have to essentially talk a lot and explain their lived experience. It's easier if someone understands your lived experience from the get-go. And that can be one of the barriers that can keep people from accessing supports as well. There was a quote that I wanted to end our time with today before I move on, and it's a quote by Chimamanda Adichie, and she talks in her TED Talk about the danger of a single story. And I think that isn't a term that people are surprised to hear these days, but I thought it was really helpful to talk about how our mental health research can sometimes the impact of it can be lost, essentially, when we don't talk about things like power. So she says it's impossible to talk about a single story without talking about power. There is a word, an Igbo word, that I think about whenever I think about the power structures of the world, and it is Nkali. It's a noun that loosely translates to be greater than another. Like our economic and political world, stories too are defined by the principles of Nkali, how they're told, when they're told, how many stories are told. These are all dependent on power. Power is the ability to not just tell the story of another person, but to make it the definitive story of another person. I think in summary, a lot of our mental health research, in my experience, is looking at how we do not define a particular group by the numbers that we find. There is a large gap in terms of looking at how mental health shows up in a wide variety of populations across our campus, and we simply don't have the numbers representative in our research to generalize the lived experiences of, for example, Black people on our campus or those who are neurodiverse. We don't have the numbers to do that. And so I think it's important for us to focus not only on things like the NCHA, but also looking at lived experience and the anecdotal learnings that we get from working day to day with students in our population, knowing that they are the experts in their lived experience, and we have to take that forward, not just to validate the work that we do, but also to hold space for the importance of having these stories on our campus and these experiences on our campuses as well. Much of the research that I think has come out of mental health work on our campuses doesn't exactly reflect the lived experiences of our marginalized populations. And so it's important to look at ways for us to provide access for those students to tell their stories, but also know that it's important as well to empower them, both on their campuses, but also on a global stage as well, to share how their lived experiences have impacted their ability to make impact in the world. And so I think I will bring it to a close there. I know that my time is coming to an end, but if there are any questions on those kinds of the kinds of work that we've been doing, I'd be happy to take them. I also, on my slides, I included some key contacts in the UCalgary context, because that's where I'm coming from. And those would include Dr. Andrew Zito, who is the director of our campus mental health strategy, Kevin Weens, who is our interim director for mental health services across the campus, but also Dr. Melinda Smith, who is our vice provost for equity, diversity, and inclusion. And I think a lot of the work that I've done kind of brings their leadership together. And I think that's how we've seen a large sort of growth in being able to diversify the kind of mental health supports that we provide on that campus for students. And that includes not only providing Indigenous supports to students as well in a variety of different ways, but also diversifying how we provide supports, knowing that we are coming out of a post-COVID time where the hybrid learning structure means that some people are learning online and some people are in person, and there is value in being able to provide access to both of those things for students as well. And so I can provide the slides at the end, but I will bring my presentation time to a close.